It's Dr. Jonathan Patali from the Environmental Health Program. He's listening in as an audience member.
And I believe this session is being recorded. Yes. So we do have a quorum, so we technically are able to vote on the minutes from last, I'm not sure what the rules are on that, but we'll talk about the minutes anyway, the summary. That was provided via email to the members. Are there any comments on the meeting summary?
No comments here.
My only comment was there was something about me making a statement about striking one agency and adding another, but I'm not sure what it's in reference to. So it's hard for me to weigh in on.
Strike DHHS and replace DES. I guess I could go back to see if there's, I don't think we have a recording of that meeting.
I was going to say I could go back to the previous minutes, but I probably don't have the draft version. I think it's probably fine.
Okay. Any other comments? Great. Okay. So move along. I don't think we can actually formally vote on that, but that's okay. We'll just, it's important for us to review our notes. So this session is being recorded. So I think unless someone is open to taking minutes, I think we'll use the transcript to create minutes instead, because it's pretty hard on people to write the minutes for these meetings. So unless someone wants to volunteer, that's how we'll proceed for now. Seeing none. Thanks for joining us today. This is our first meeting with me as chair and Nancy Murphy as vice chair. That we were elected last meeting. And I thought we would proceed with first getting an update, if possible, from Karen Craver. If you have anything to share with us, if not, that's fine. We can start that up next time, but then review the charge of this commission again, and then sort of look at where we stand with some of the items in the charge and sort of make a plan for moving forward. Unfortunately, some of the subcommittees haven't been meeting, and so you might want to reevaluate membership on some of those subcommittees moving forward, and see if those subcommittees should be assigned some tasks that I kind of just jotted down last night or yesterday on the agenda that we could have for discussion. So Karen, do you have anything to share with us
Sure.
as an update? Great.
Yeah, I can provide updates, and I've been asked to provide updates for DHHS as well. Abby sent me her talking points. So great. I'm just going to read through those. I can't promise to be able to answer questions to them. One thing that you will notice in the updates is, sort of some overlap across agencies, and hopefully that highlights to everyone how we coordinate across agencies. So I'll start by reading the DHHS updates, and I'm going to put some of this in the chat for everyone. So DHHS launched an updated website on May 3rd, 2022. The new website includes a dedicated page for environmental health, including PFAS, with resources from both state and federal partners. I have 3 links for all of you, including a link to the main page, the environmental health page, and the PFAS specific page. And I'll put those all in the links when I'm done giving updates. The next item I would invite Peg DiGiulio to weigh in on as well, if she wants to speak about this, but the environmental health program at New Hampshire DES connected with Peg about supporting efforts to educate nurse practitioners about PFAS at a nurse practitioner conference for Northern New England. We invited DPHS partners and also community members. So I would say that I would invite Nancy Murphy to speak about this as well, to participate in planning and conducting the presentation. Our own toxicologist from the Environmental Health Program, Dr. Jonathan Patali, who's in the audience today, could also weigh in on this because he was also one of the co-presenters at that event. And we're committed to continuing, both agencies are committed to continuing to work with stakeholders to advance provider understanding of matters related to environmental health. The next update is about our Choose Safe Places program, which is part of AppleTree, which is our ATSDR cooperative agreement. AppleTree stands for ATSDR's Partnership to Promote Local Efforts to Reduce Environmental Exposures. Within that, there's a component related to safe siting of early care and education programs, and that sits over, it's led by partners at DPHS. So the New Hampshire Choose Safe Places for Early Care and Education program is implementing a multidisciplinary approach to reducing exposure to contaminants from water, air, and soil in early care and education facilities throughout the state. CSP, which is the Choose Safe Places program, has partnered with the Children's Environmental Health Network, Eco Healthy Child Care Program, the New Hampshire Bureau of Child Development, and Head Start Collaboration and Pro Solutions to offer 200 free courses to the Eco Healthy Child Care Environment Health e-learning training to ECE providers. That was a mouthful, so if I got any of it wrong, I'll be sure to send over these written notes so that you can have them. To date, 69 courses have been taken by providers from around the state, and the training was also offered to the 10 licensing coordinators from Child Care Licensing Unit within DHHS. With input from its 14-member advisory team, which meets monthly and is composed of stakeholders from the ECE community, health officers, and state partners, CSP deployed a health officer survey and used the results to provide targeted questions for a health officer focus group held at the end of March, along with a focus group for licensing coordinators. The results of which yielded excellent insights on the gaps and opportunities in the childcare licensing process from which environmental health tools and best practices can be developed to reduce exposure to harmful contaminants in childcare settings. Finally, a well water sampling data exploration pilot was launched on May 6th to provide free testing and treatment funding options for ECE providers on private wells that serve less than 25 people who choose to participate in the pilot. The pilot will provide free testing that will count toward the required testing as mandated by the Child Care Licensing Unit, a well water testing and treatment toolkit as a permanent resource for these providers using wells, and data on contaminants found in well water at ECE facilities to be added to the private well dashboard database, which is being used to develop a mapping tool to assist health officers in identifying ECE facilities at higher risk and hotspots in the state where contaminants are likely to occur in well water. And then I have one more update from DPHS, and that's about the Merrimack cancer investigation. The Division of Public Health Services at the Department of Health and Human Services continues to convene the Cancer Concern Review Team to look at cancer data more closely to determine the focus for next steps in the investigation into the excess of kidney cancer observed in Merrimack, New Hampshire. The CCRT, which is that Cancer Concern Review Team, has completed the assessment phase of the investigation and is currently preparing a report summarizing the department's data analysis and recommendations for next steps, including the feasibility of conducting an epidemiological study. The department anticipates the report to be finalized by the end of May and will provide an update and/or share the report if it's complete at the next commission meeting. So those are all of the DHHS updates. Normally after updates, I'd ask if there's questions, but since these aren't from my agency, I would encourage you to reach out to Dr. Bush if you do have questions.
Great.
Then,
oh, go ahead.
Oh, well, I was going to say, I also have DES updates, but I'd be happy to take a break if there was something else that you wanted to put in the middle. Either way.
Yeah, I was going to say, since you mentioned maybe Ms. DiTullio could update us on that conference, and if she can start out, and if there are any additional items Representative Murphy wants to talk about, that would be great. And then maybe go to DES if that's okay with you.
That sounds great. Thank you.
You're on the spot, Peg.
All right. Good afternoon. It's afternoon now. So I first want to say how happy I was with the result of the session at the Nurse Practitioner Association conference, and to thank again Dr. Patali and Karen Craver and Nancy Murphy and others who worked to make that session so successful. I think that I don't have formal feedback yet from the evaluations. I should have them for the next commission meeting, but I think you don't really need them necessarily to have seen that 25 people stayed for the last session of a 2-day conference on a Friday afternoon, and not just stayed, but were actively engaged and stayed through the question and answer period beyond the end of the session. I think it speaks for itself that that this was certainly an issue that the NP community was interested in hearing about. I have reached out to Kim Mohan, who is the ED of the association, and the plan is to get something in early this year. So early would be a request for a session time more in July or August, versus we got a late start last year, and that's why we ended up in a bad spot. But I think that making this an annual something related to this collaborative effort in whether it's lead, arsenic, PFAS, whatever, to have a session for every conference that addresses something, and this collaborative effort, which is just such a good example of public-private, partnerships. It's just a great thing. So I was very happy, and I will be anxious to share the feedback formally from the people who attended. And I will pass along to Nancy Murphy or Dr. Vitale if you want to make any comments.
I thought it was awesome. Peg, thank you so much for inviting us and allowing me to be part of that. The nurse practitioners were totally engaged. I really think it. I think it sparked a lot of questions and just about the patients that they see. And I think your recommendation as to including the issues as differential diagnosis in the PFAS related issues that they're seeing people and may only see a single issue at a time, but maybe retrospectively looking back and say, hey, wait a minute, look at this thyroid issue and look at this PCOS and look at, whatever. They start to put the pieces together. And I think this is sort of foundational. I too was amazed that so many people stayed so long and asked so many questions, and they were fired up. And I think that the information is going to spread, and I can imagine that next time would be better. So thank you. And thank John. You both were awesome. So my 2 cents. Thanks.
Great. Any more comments on this? I think this is really important because, we have been discussing a couple of months ago in the education subcommittee report about expanding this kind of education, not only to the nurses, but also to physicians, which is, it's been a conversation that we've been talking about for several years in the state of New Hampshire. So I think it's a great pilot study to kick that effort off. And perhaps moving forward, the education subcommittee can use what, your model, and hopefully, Peg, if you could be involved in planning that further for other healthcare professionals in the state, that would be a great thing. So thanks so much for that. Are there any more other comments on the DHHS information?
So not specific to the DHHS information, but just adding on and, sort of responding to what Peg said about that conference. Our program, the environmental health program, is very much committed to continuing to work with Peg and others on that. And there's nothing set in terms of a date yet, but we are working with New Hampshire healthcare providers for climate action to put together a presentation about the importance of well water testing and the reasons behind why it's important to test. So stay tuned for more.
Well water. Great. Is that Representative Woods?
Yeah, just a sidebar question just dawned on me. Early on, Representative Rum had a cyanobacteria piece of legislation to study that relative to ALS, and I must apologize. It sort of fell off my radar. Is there any update on that, or anybody have anything that more about that? That's something we should be following.
I don't have an update on it. I know it was lightly discussed in our previous commission meeting this morning, but that is something we should be tracking. And it is on our list of the health subcommittee had started a list of environmentally triggered diseases, and that is on our list, and it's important. So we should get an update. Karen, do you have a comment?
Yeah, I was gonna say, if it would be helpful to this group, I'd be happy to talk to David Niels from our cyanobacteria surveillance program to see about coming to give a presentation to this commission.
That would be great.
Okay.
I just wanted to get it back on the radar.
Yes.
I'll note that as an action item for me to follow up on.
So you're going to be able to provide these summaries to me, Karen, hopefully in email. Great. So I can just plunk them in. Awesome.
Yep, exactly.
Any other discussion on the DHHS portion of this? Let me go into the DES presentation from Karen. Okay, go ahead, Karen.
Okay, thank you. So I'll start with Apple Tree specific updates, and the Apple Tree, again, that's our partnership with ATSDR, and it sits within the Environmental Health Program, which is the program that I'm the administrator for. We continue coordination with our federal partners at the EPA and ATSDR, as well as with other programs throughout New Hampshire DES and DPHS to reduce exposure to environmental hazards. As indicated by the cooperative agreement, our focus is on national priority list sites, but we are also able to add additional state identified sites. Some of our state identified sites include the community of Hooksett, and we've also been successful in establishing statewide sites, one being relative to human caused contamination and the other being relative to naturally occurring hazards. In Hooksett, we're working with town administration to promote further testing and treatment based on analysis that showed high levels of uranium and other contaminants in private wells in the community. And the statewide site allows us to offer technical assistance and communication to communities and to support other private well testing initiatives, including ones like the Seacoast Initiative that's funded by the Drinking Water and Groundwater Trust Fund. I have really exciting news. We've recently hired a new risk assessor with a background in environmental and ecological toxicology. We're super excited to have her on board and to have this enhanced additional capacity. And it's great for Dr. Vitale to have a toxicologist friend. Through a contract with the UNH Survey Center, the Apple Tree team recently wrapped up work that was aimed at better understanding environmental health related understanding, perspectives, and prioritization among New Hampshire residents. Some targeted focus groups were held to support work related to safe siting of childcare facilities. And I mentioned that before, that's sort of some of that overlap that you'll see. And also to help us to better understand the usability and understandability of communications materials created and distributed by New Hampshire DES. Our ultimate goal is to ensure that the materials that we produce are produced in a manner that drives action to reduce exposure. I do have more, but I'm hearing a lot of feedback. I'm just wondering if others are hearing that too. Jawei, is it possible to mute the room just while I'm giving the updates, but then to open back up the sound for questions and answers?
Yeah.
Okay, thank you. Okay. Let's see. Through a contract with Dartmouth and in coordination with partners at the New Hampshire Division of Public Health Services, we've developed multiple training modules and a resource guide aimed at supporting local leaders in response to concerns related to environmental health. There will be 2 Apple Tree specific modules, one that introduces people to state and federal partners and resources available to help them, and it's organized by different topic areas. This module and the accompanying resource guide has been introduced, and we are going to be recording a version for posting very soon. So I'll keep you all posted about that. The second module is about different environmental contaminants and covers health risk and relative risk information. And then there's a third module, which really is being led and sponsored by the cancer program at DPHS, but is meant to complement this suite of training modules. And that one is going to be specific to cancer cluster investigations. So I'll move on to some broader environmental health program efforts. We're continuing to work on developing a chemical information database. The information being entered largely comes from the ATSDR toxicological profiles and tox FAQs and information from the EPA, but it also includes New Hampshire specific details, for example, where there are state specific MCLs. The purpose of the database is to create a one-stop shop for understanding and communication of risk among staff across New Hampshire DES and the New Hampshire Division of Public Health Services. Following a meeting with community members from Merrimack about the ATSDR draft private well health consultation that was released earlier this year, or actually, I think maybe at the end of 2021, our team convened a meeting to bring together state agency staff, community members, and academic partners from Dartmouth, UNH, and Boston University. The purpose of the meeting was to connect stakeholders with an interest in advancing or supporting research relative to PFAS and health, to provide stakeholders with the various perspectives, including those related to the research process, as well as community concerns, and to consider potential analysis or background work that could be done to put academic partners in a more competitive position for future research funding applications. And while I'm speaking about academic partners, our toxicologist who's here with us today, Dr. Jonathan Patali, is involved in multiple projects with academic partners to advance the science on PFAS. If it's of interest, that's another presentation that I'm happy to set up for a future meeting. He can share more about the projects that he's involved in. And then members of our team, including Dr. Patali and one of our risk assessors, are continuing to follow the EPA Science Advisory Board relative to review of PFAS standards. In addition, Dr. Patali continues to follow and review scientific literature related to other PFAS compounds, including those not being reviewed by the SAB. Our team is continuing to support DPHS efforts related to the investigation of the incidence of kidney cancer in the Merrimack community, and we're committed to continuing to support that effort. So that wraps up our updates, and I'm happy to take any questions.
Are there any questions? I actually have a question. You mentioned NPL sites. Can you just kind of go in a little bit more detail what kind of work you're doing on NPL sites in New Hampshire?
Sure. So we meet on a quarterly basis or as needed with our waste division site managers. So each of the NPL sites in New Hampshire is assigned to a site manager within our waste division, and they coordinate with the EPA. We meet on a quarterly basis with both the waste division site managers as well as with the EPA to review activity that's going on around the site. And the type of support that we can offer and that we often offer is review of any risk assessments that are conducted relative to those sites, review of any risk communication materials, so if there are letters going out to homeowners, that sort of thing. And then also we're available to participate in public meetings as sort of a landing place for health related questions that might come up.
Is DHHS involved in that work at all? And I wondered if one of the things I've noticed in the last couple of days is that when private well owners are notified about PFAS, when they've been historically notified, it was under the old 70 part per trillion, and I didn't see any record of updates to those notifications. So this is specifically around NPL sites. I was wondering if that kind of communication is planned moving forward. That's updating with new regulatory standards as they become new.
I can follow up with so I'm not the principal investigator of the ATSDR cooperative agreement, but that individual sits within my shop, and I'm happy to follow up with him as well as the site managers to ask more specific details about the communication that goes out. You asked, I think, also if DHHS is involved in those meetings. They are. The Apple Tree Cooperative Agreement, we applied in partnership with the Division of Public Health Services. And so that cooperative agreement funds a principal investigator and a risk assessor over at New Hampshire DES within the Environmental Health Program, and then an individual who manages the Choose Safe Places component of the grant, as well as provides health education and risk communication support to the overall Apple Tree efforts. So that individual is part of those meetings as well.
Great. I just realized I used a term NPL. So if people do not know what that is, it is an EPA Superfund designation, national priority list sites, and there are about 20, I think, of those in New Hampshire, across the state of New Hampshire. So that was what I was wondering about. Are there any other questions for Karen? Nancy, I knew you had a question.
Actually, it's sort of partially unrelated, but I just wanted looking for some direction from Karen. Can you tell me who I would meet with? I don't know if it's DHHS, DES, or regarding the role of health officers in communities. I mean, I've looked up the law, I've looked up what certain health officers do in different communities, but I'm really confused because it seems like it's sort of all over the place. And I would love to have just sort of a little sit-down meeting with somebody that can tell me what the role is, what DHHS believes they're doing in communities, what communities can be expecting from the health officers, because I know back a while ago there was some legislation that was going to look at, you know, them taking a different role in terms of things, and I really want to have a better understanding, and I know not now, but who would I talk to about that?
Yeah, so there's a health officer liaison unit at the Division of Public Health Services within Department of Health and Human Services.
Okay.
The two staff people who are part of that program are Sophia Johnson and Matthew Cahalan. I can't promise a presentation from an agency that's not my own at a meeting, but I'm happy to, if that's of interest to others in this group, I'm happy to take that back as a something of interest and share it with DHHS to see about having a presentation.
I wasn't asking for that. It's more just for my own personal, you know, I'm looking at my role in the town council here. I'm looking at, you know, all the commissions. And so I really just personally want to have a better understanding, because I'm getting conflicting and confusing information. So I just wanted to know, I knew you would point me in the right direction of who I would need to speak to. And then, you know, I don't know, maybe if I find out some stuff, maybe I might say, yeah, I would agree that a presentation was, but I'm just thinking more just for my own personal understanding. So Cynthia Johnson, you said? It's
Sophia Johnson and Matt Cahalan, but I don't worry about the names. I'll follow up with an email to you, Nancy, and I'll copy both of them on that email.
Awesome. Thanks so much. Thanks, Karen.
You're welcome.
Great. Any more questions for Karen on the updates provided? All right, seeing none. I'm going to move on into the charge review. So unfortunately, this, you know, as a natural progression of commissions like this is that as elections happen, we get new people involved. So I kind of thought, well, maybe it wasn't really an appropriate time to do this right now because, you know, we probably will have some changeover in the fall. But I still think it's maybe important just to kind of go through a little bit and sort of reevaluate where we are and where we need to go. And also talk about subcommittees a little bit. So unless people are not in favor of that, I think we should go through and look at kind of where we stand and where we're going to go in this commission moving forward, kind of look for holes and things that we maybe haven't addressed. So the charge of the commission I provided everyone with a copy of the enabling legislation for this commission. And I want to go through starting under section 3A, the commission study shall include. I think we've pretty much handled number one, which is determining entities that report. I see, that's from Karen. Okay. So we pretty much understand that, I think. And if anybody at any point just want to, Nancy, you want to say something about that?
Yeah, actually, you know what? I'm sorry, but can we just go back just before that section to section 2? And one of the things that I'm just thinking, not only for this commission, but other commissions, just looking at, should we be looking at making sure that we have all the members that in these? Because I'm looking at just in terms of, I think we have most of them probably in this commission, but we don't have BU public health policy. Let's see, Gary, I think Gary's New Hampshire Medical Association, right? Is that true, right? That was it.
No, it's Mr. Timmons is.
Mr. Timmons is, okay. Yeah, I just one of those things that I think, I know, there'll be changes in the fall, but just another thing that I think we should consider is just maybe at that time, re-looking to make sure that we, consider looking into any of the missing members, just so that, it's in the legislation, the language of the legislation, and if it's possible to fill those positions, I think it certainly benefits the commission. But sorry, I know you were going.
Yeah, no, I think the minute that I started to look at, when we took over, I did try to find a real up-to-date list on who the members are. It's not as easy as it sounds. So I'm not even sure if we know of the legislative appointees necessarily to this commission, other than the people who come. Like I'm not quite sure who they all are. So if there's anyone that can help with that, that would be Nancy. I don't know if you and I should get together and just talk about that a little bit. Happy to go and, go through the list and try and make sure we have people identified and reach out to people that aren't part of this, but I haven't had a lot of success doing that so far, but it is a work in progress. And I agree, definitely, certainly in the fall, the legislative appointees will change.
Yeah.
So that will be time we'll have to look at that again, but yes, I agree 100%.
Thank you.
I think PEG is number 9, right? I'm not sure who the Board of Trustees of New Hampshire Hospital is supposed to be. And I think Amy is number 5. Yeah, I mean, I think most of them are covered, except for I'm unsure about the legislative actually appointees.
Mindy, I
Okay.
just put a link into the Board of Trustees for New Hampshire Hospitals, just so that way we can access their page and see who's on that.
Thank you.
You're welcome.
I gotta copy these. I'll do that later. Great. So I do agree, though, that we should look at that list and make sure most people are filled, those positions are filled. So recommending ways to alert public health officials regarding higher than expected rates. I think a couple of these now seem to be handled by the new dashboard, Karen, that you were talking about in your introduction. I haven't had time to, I haven't seen it yet, the new dashboard, but do you think it's possible for, so you provided us the link. Do you think it's possible for you to take a look at that dashboard and whatever sort of reporting requirements reporting things that you have in place between you and DHHS and sort of evaluate which of these numbers have been covered already by the agencies? Like, I'm not sure, there was a lot of discussion on notification of the public. I'm not sure if new things have been incorporated into those dashboards or some other reporting mechanism that you have.
Are you talking about the New Hampshire DES data platform, One Stop, or the DHHS well water dashboard?
I'm talking about, you had talked about the new dashboard in your intro. I thought it was environmental health tracking.
Yeah, so
May 3rd.
Environmental public health tracking sits over at DHHS, so I would definitely defer to Katie on that item. But okay. I'm happy to work with her for that review.
Okay, yeah, that would be great if you two could sort of go through this list too and say, yes, we've done this, no, we haven't done this. And, most of the stuff we've already discussed over the years since this commission was, I think it started in 2019. So we've been kind of operating for a while. But it would be great if we could all evaluate what kind of where we are in terms of all these items now. Because I think, informing citizens on chronic disease management and exposure related, I think that dashboard kind of covers that. It's in theory, I haven't looked at it.
I don't know that the well water dashboard would be what covers that, but I certainly think that, and again, I don't want to speak out of turn. I think that's a DHHS question, probably for the chronic disease program, chronic disease prevention and screening section, which is headed up by Whitney Hammond.
Okay. Recommending data sources and a method to include data compiled by public and private entities to the greatest extent possible in the development of the public health oversight program. This sort of sounds to me like an index of resources that I don't think exists unless the agency is aware of that.
And I mean, so each of the agencies has their own data portals. So there is that, but we certainly look to other data sets, like the Dartmouth Atlas or CDC data. We certainly look to federal sites as well. So I don't know that there's one comprehensive sort of summary of all of the different data data sets that would be useful.
Do the websites of the agencies have links to the Dartmouth Superfund program and things like that that are resources that people might use?
So the environmental health resource guide that I mentioned in my updates that was developed through that ATSDR partnership is a presentation on that might be useful for this group as well. And I don't know if it's possible to coordinate with all of the legislative commissions that are focused on environmental health so that everyone can hear the same message. But that is a resource that if you read it left to right, it sort of starts with broad topic area and then gets a little bit more narrowed down and then provides links to specific programs and resources within the state as well as federal and other. And so the Toxic Metal Superfund Research Program would be referenced in that site. We've also worked historically with that group on various items, including the development of a New Hampshire specific PFAS like infographic fact sheet. And that's something that we have posted on our website at DES. And I believe New Hampshire DHHS also has that on their site as well. So there is definitely cross collaboration and posting.
But that's for PFAS, but not necessarily for other things like uranium and right.
Oh, that resource guide is for everything
okay.
under like everything in the kitchen sink related to environmental health. Yeah.
Representative Murphy.
Yeah, thanks. I attended that little training. It was short, but it was phenomenal. And at the time, I think it was like the 4th or something, May 4th. There were going to be updates, new links. That's all set, Karen? It's all ready to go?
So yes,
because I didn't make it public. I mean, I think it's a phenomenal resource, but I just didn't want to confuse the thing by sending out that information and then have people say these links don't work or whatever.
Yeah. Thank you for not making it public yet, because I think you're right that would create some, frustration. The timing of when our contract went through with Dartmouth and the timing of the DHHS update, the stars didn't align for those to work out exactly right. But DHHS is committed to updating all of their links in that resource guide so that it can be shared. So an updated version is actively being worked on.
Okay, do we have a sense of by when? And I know I've told people because it's so easy to follow. It's just intuitive, and it would save a lot of calls to DES and DHHS. People can, it's something that I think is really important for, communications subcommittees. I'm thinking like 737, the same thing. We talk about wanting to get the information out, and it's all there, but we've been telling them it's coming. So
yeah. So again, I can't speak for DHHS, and we're looking for them to update those links because they'll be able to navigate their site a little bit more easily. But our team is presenting on the 24th or 25th of the Drinking Water Source Protection Conference. And I did ask that I could have it in time for that. So I'm hoping within the next couple of weeks.
Okay, great. Thank you.
You're welcome.
So it sounds like maybe in time for our next meeting, it would be ready in mid-June or something.
I hope so, yes.
Yeah, that would be a great, and we can send that notice out to the 737 and 2 other commissions I know, would also benefit from that kind of a presentation. So if we could do something along those lines, that would be great.
Yeah, we'll have so we did it live, and then we're doing a polished recorded version actually on Monday. So what I would recommend is that we show the recorded version, but then have the team available for questions.
Perfect. That sounds great. So for our next meeting in June. Great. So that would cover some of those, some of those 1 through 4 items that we were just talking about. That's great.
Yeah. Yep.
I know that we haven't done necessarily number 5, and I do think that would come. So you mentioned a list of environmental hazards and then outcomes. Is that something you can share with us? Because it sounds like that's a duplication of an effort that we started here in this commission under the data subcommittee.
It's not complete at this point. It's in process. We have one of our risk assessors working on filling it in as time allows, you know, with all of her other sort of job requirements. So I'm happy to share the structure of what that would look like and some example contaminants so that you can see sort of the level of detail that's provided, if that would be helpful.
That would be helpful, yep. Is there any effort to add in the codes associated with the outcomes in that table?
Oh, like the ICD, and we are not doing that, but you know, I think that is something we could look into with, you know, partnership from maybe our friends at the IHPP.
Yeah, because I think that would help facilitate some of the coordination and the looking at other outcomes other than cancer associated with exposures. Unless Amy has another idea. I think that's kind of where that connection would be important.
Yeah, I think, you know, I think one of the things that we want to think about with the health outcomes is what kind of data we have that reflects the residence location or zip code and how permanent that is. So I think there's sort of two issues, and I haven't answered your first one, but there's also, and maybe Dr. Timmons wants to jump in here too, but there are codes that may end up on the claim for things that are, you know, actively being treated. And there are codes that may end up there because it's part of the member, the patient. Obesity is one of those maybe funny codes that will maybe be on the claim because it's being actively treated, that may not make it onto the claim if it's not being actively treated. And so there may be some concern that we have underreporting of obesity. I think the same is true from what I understand from my clinical friends with infertility. You know, if that is not part of the claim or the visit and it's not part of what's being treated at the time, then you may not see that on the claim. So that might not end up as part of, you know, say the discharge record for discharge data or part of the claim for claims data. That being said, you know, I think, you know, starting with, you know, we have a, you know, certainly the cancer diagnoses are the things that are actively being treated. And then I think it's also kind of exploring that address issue and understanding that for, you know, let's say 80% of the members, is the address the same? So is the exposure the same in that particular geographic area? So, you know, I think it'll be good to go through those health outcomes and go through that with our clinical friends and, you know, maybe sort out what would make sense for a first pass,
Yeah.
You know, beyond the cancer conditions, but things that we think are really going to be there if they're really part of the patient,
Right.
what things are potentially going to be left off. Asthma is another good one. You know, I think about like asthma doesn't end up on all my claims, but I have it. And so I think, you know, we just want to be kind of careful about that.
Yeah, I think like you said, it's a good starting point though, and then we can look at you know, understanding that there is probably underreporting, but possibly at least have something to start with. And then, like you mentioned about the, you know, the residency time, that's, you know, a little bit further down the road too, I think, in terms of like we'll have the codes, at least the structure of the tables set, you know, what we want to look for set up. And then when we get into more of the geospatial type of analysis, I do think that's an issue. But that isn't something that we are able, as far as I know, able to address right now, because I don't think it's being actively queried in any kind of, I mean, you can do the address search for the person, the patient, to see if they've moved manually, but it's not really something that we track in our state, right? necessarily,
I don't
or
think it's being actively analyzed, but certainly within the data that we have at IHBP, there are multiple years of claims data. And so if we were to see that member across time in the same zip code with some relative frequency, I'll tell you what I think about. I woke up in the middle of the night thinking about Medicare patients. Oh my gosh, the snowbirds, you know, and they're gonna have exposure in certain seasons and then, you know, not be part of that, you know, and they're moving back and forth, you know, and how do we account for that? But certainly, you know, having address information from the claims data can start to tell us a little bit more about the persistency of their location, and then help you know, help all of us understand how much we want to attribute to their location, their, you know, and their exposure.
Amy, I'm wondering if there's anything that you would like to, or that your work, you know, would benefit us with if you had something to report into us, a presentation on the kinds of things that you're doing, or not?
Maybe. I mean, I think the things that you want to know about are largely getting done by DPHS. You know, the work that I'd love to explore is, you know, kind of looking at that address information. You know, and we've been talking with a couple folks, you know, about that. And, you know, it's, you know, maybe the next hurdle for environmental health. Yeah, so I don't have anything to present today per se, but I
No,
think
not necessarily
like
today.
You know, well, I mean, like today in air quotes. But I do sort of wonder if that's something that the health subcommittee would want to contemplate, is what are those additional conditions that we think that we should see on claims, because they would be part of an active treatment plan, and what are those maybe edge conditions, or conditions that may or may not end up in claims or discharge because they're not part of the treatment plan today.
Yep. So I'm going to say this should be assigned to the data subcommittee to look at.
Data subcommittee, okay.
Yeah, I think that's a good
I
idea.
think I mixed up because PFAS is health, right?
Yes, I know. I constantly have a problem. If I said health, I apologize too.
No, it's all right.
For the same
we'll do
reason.
health data, then we cover all of our bases.
Right.
But yeah,
Okay.
I think doing some work on that as the commissioner would be great.
Yeah, so I think maybe using the structure that Karen can provide. And Karen, I don't know, you know, understanding that actually this will always be an evolving table anyway. So as more information is gathered, you know, like every 5 years, the state's supposed to reevaluate the PFAS levels for the MCLs, you know, so I think it's always going to be recognized that this is an evolving field. And so if there's anything to the extent that you could share with us so we don't duplicate efforts, if we can copy the structure, we already have a structure started, but we might want to change that a little bit just so we don't duplicate efforts. And then the data subcommittee should take that up again and add codes in and have that discussion on what appropriate codes there might be to add into that table as well, I think. Nancy, were you going to say something? I could tell you're thinking about, okay. Okay, that'd be great. So moving on, number 6, studying health databases, including years available for small area analysis and privacy concerns. That's kind of something you were just talking about, Amy, and certainly something that the data subcommittee should probably look at. I think there has been some of that done with the arsenic study, correct, and the uranium study now possibly, or the biomonitoring, I guess, in general. Karen, that DHHS, you probably don't know, aren't able to speak to that, but.
Yeah, I was gonna say, I would defer to DHHS for information on that. I just don't wanna, I know I used to be a DHHS employee, but I wanna make sure I stay in my role as a DES employee today.
Okay. Number 7, researching currently existing health data reports by agency, bureau, organization. We've kind of been doing that along the way and being reported into from DHHS and other agencies. but certainly should be an ongoing thing. Number 8, creating a model of desired outputs and chronic conditions. That's what we were just talking about for the data subcommittee. Number 9, identifying gaps between what exists and model output. It's probably another data subcommittee assignment. Recommending organizational structure responsible for oversight and function of mandatory reporting requirements. Not really sure what that's referring to. Not sure what that refers to.
Can you repeat that one again? Sorry. I know I have
Number 10, yeah, recommending the organizational structure responsible for the oversight function and mandatory reporting requirements.
Is
Not
that
really
just
sure.
Is that just relative to this commission? So would that
Yes.
would that be just
Oh, no.
establishing chair and co-chair?
No, I think it's not that. I think it's broader. I think it's more the subject matter. I'm not really sure what that is. Except that I guess maybe it means identifying not sure. Perhaps it's just agency structure. Number 11, reviewing results of stages 1, 2, and 3 of the pilot study. I think it's the arsenic pilot. I don't know if anything more is going on with respect to that other than the first, except for it kind of became the biomonitoring trace investigation. So we should probably have DHHS update us on that then again, if there's anything new. Number 12, identifying technology system changes necessary to carry out the charge. So we kind of had some, Amy, you had the EBC people come and speak to us, which was great. I think that's kind of where this charge was going. Maybe we should take another look at that at some time in the next couple of months and see if there are additional systematic changes necessary. Because, I know Senator Sherman had a bill in a couple of years ago to look at additional staffing. There have been some staffing updates, as you just told us again today, Karen. So I think as we move into the next legislative season, I was going to recommend actually that we form a legislative subcommittee in this commission as well, and look at potential legislative recommendations that we would have for the next session. And the timing of that is actually pretty good because the report's due November 1st, and we're going to have new representatives. So it's actually a good time to really look at that. So maybe we could get sort of an update on staffing and systematic possibilities that are necessary to in terms of this commission's charge. Not at the next meeting, I won't do that, but maybe, I don't know, maybe, what do you think, July or August, so that it can get into our November 1st report and then also be there for the legislative subcommittee to make recommendations?
If it can go a little bit, the later it can go, the more chance that we'll have we're expecting some funding opportunities to be announced. And, that has an impact for informing what positions we can fund and how we'll be staffed up. So, if we can push to August, I think we'll probably know a little bit more.
Yeah, I was just going to suggest kind of stepwise, maybe at the next commission meeting, we can review the notes. I would love to say that I retained everything from the presentation that was done last year about Corby, and I'm not putting Chaway on the spot, but I know, Andrew and I think Bill or Al had suggested that if there is funding, maybe that's the legislative initiative around staff, that Corby could be a place for some more environmental health information to live. But I think, again, would never want to have this conversation without Katie in the room and understanding what the future vision is for EPHT also, and whether there's already plans or, for things around Corby as far as the environmental public health tracking.
What do you call it, Corby?
Yeah, Corby is the business intelligence tool that Andrew and was it Al LeMay or Bill that had come to talk about it last year and was just kind of outlining like that, you know, it's kind of modular. You know, so if there's a module that's not already represented that would inform what this commission is looking at, then that might be something that we would be interested in finding funding for, or you know, talking with folks around the state that are already going to be getting funding about, you know, incorporating some type of work in Corby. But I think if we can refresh our memories about that, I don't think we need to haul them back in. But
yeah, no,
you know, I think just kind of dusting off the notes from last year's presentation and or, you know, the slide deck. And maybe that's something we do in the interim for our next commission meeting. Is just recirculate that.
do you think you could work with Katie to do an update to the commission next meeting on that?
Yeah.
Great. I'll put that on the agenda. Well, I'm assuming Katie will go along with it.
Yeah. Yeah.
She's not here, so she gets signed up for it now.
Voluntold.
Yeah, that would be great. So we'll look for an update in June on the on that EBC presentation and kind of where to go. And then I'll have on August an update from Karen et al. On the staffing issues. And then I saw Nancy look like she was going to make a comment.
Actually, before Nancy, sorry, excuse me, just before we go there, June, what is the date for the June meeting?
We'll do that at the end. We're still not quite done with our charge. We're almost done, but if you don't mind,
so I may or may not be doing a presentation in June, is all I'm saying. If it's June 10th, I'm not here.
Oh, we'll do whatever works for you to be there. How's that? Nancy, were you going to say something?
I was actually just looking for clarification around a legislative committee. Were you talking about creating a separate subcommittee within the commission? Oh, okay. Is there thought to having each of the committees, the current ones, also suggesting legislation from within that committee to put together for, okay. Yeah, that was, thank you.
Yeah, we're going to talk about that after this, after we get through this stuff. All right, so that number 12 is covered with next meeting, at least in process. Collaborating with the NIH, EPA, and CDC to develop protocols for human health and human services to educate and provide guidelines for physicians. So that's something we should for the education subcommittee and use the next month, Peg, you could report into us on the survey information from the nurse practitioners thing. That would be awesome. And then the education subcommittee can take that and use that in their discussions about physician education. So we'll continue that. I do think that's something that you know, we've been continuing to hear from community members, the need to educate physicians and healthcare professionals. So that's a really important charge of this commission, I think. Number 15, recommended legislation. We just talked about that. Appropriations. Got it. Okay, so I think we've made it through. We kind of have a sketch work. Are there any other suggestions about things that we haven't talked about right now that need to be done to, or ideas that we should be doing to either presentations or tasks that the subcommittee should take on, or maybe even new subcommittees to address the charge of the commission that anyone has in the back of their head? Hi, Peg, go for it.
Oh, well, I just want to go back to the item that the membership on the committee. So back where where Nancy had brought up, Mr. Timmons, I think, represents the New Hampshire Hospital Association. Am I correct with that?
I think that's correct.
Okay.
Okay.
So that would mean that what we're missing is the representative from the New Hampshire Medical Society. I don't think was ever replaced after Dan withdrew. Is that correct? So if that is, what I would say is that's probably a real priority, because we need a physician representative who's active in practice to try to engage the physician community as we try to, right?
Yes.
Yeah. So I just want to make that point that would be a very important piece for the future.
It was Dan Tisnick before.
He was
Yes.
a physician assistant, and then he went over to Afghanistan. He got
Oh, that's right.
yes, and then he came back but was unable to fulfill that role, and the medical society never replaced him on the commission. Yeah. So anyway,
That's a really good point.
That'd be important.
That's a really good point. Yep. Sorry, Mr. Timmons, I misapplied you to a different role.
Yeah, I wasn't sure which one, but it's the New Hampshire Hospital Association that usually reminds me about the meeting, so that would make more sense. And can I fill both roles, or?
I mean, certainly we would appreciate you filling both roles. I'm always of the opinion that the more the better, so I probably will still go back and ask for another representative from
Yeah,
New
I would
Hampshire
agree.
Hospital. Yeah, just so we have, I'd rather have, absolutely, we'd love to hear from you on what you think, but it would be good to have more than one if we could. And I also know that Representative Woods has connections in New Hampshire Med, although, so I rely on him quite a bit for stuff too on this issue. But that's a really good point, Peg. Thanks for bringing it up. Any other suggestions on, I know we had sort of been talking about the need for a Department of Education presentation for the last couple of years. So if anyone has a suggestion for the appropriate contact to reach out to, and I know the HB737 Commission wants also to have a presentation, so it'll be one of those combined presentations. So if anyone has a recommendation for who to bring that request to, we'd be open to it. We just want to know about what kind of data sources are available to connect up to our chronic disease database reporting structured table that we're talking about, because we feel like it's not captured. We know that, for instance, lead has an effect on educational outcomes and exposure to lead in children. And so we were hoping to bring that kind of to the table and have that be part of this systematic environmental exposure issue be addressed. Does that make sense? If somebody knows anybody in DOE, let me know. Nancy and I will be working on that. Great. Okay, so as I kind of said, we went through the charge. If there's nothing else on the charge to talk about. So we do have subcommittees. We have the education subcommittee and the data subcommittee. As I said, I want to suggest another legislative subcommittee, which may or not be super active right now, but may be active in the August timeframe as we're getting these report-ins that we were just talking about today on staffing and other perhaps EBC stuff we'll be talking about our next meeting. So Representative Salloway is the chair of the education subcommittee. If there are any members who want to be involved in that subcommittee who are not already part of that subcommittee, please email me and let me know. I'm not sure, Representative Salloway is not here today, he's ill, so I don't want to speak for him, so I'll let him, I'll touch base with him and see if we can get that subcommittee moving again. But I think there's a lot of important tasks that subcommittee is responsible for. The data subcommittee previously had been myself and Nancy Murphy, Amy Costello, Katie Bush, Representative Woods, and Mr. Tizik, I think, was the chair. And then when he left, I took over. We haven't had any meetings lately, my fault. And so if anybody wants to be part of that subcommittee, the data subcommittee, also please let me know, but we should probably work on getting that restarted and try to talk about some of these issues that we're talking about here today regarding the database. And if there's anything, Karen, you can provide for us to start working, adjusting our table, that would be great. Is there anyone who wants to lead the legislative policy subcommittee that will start later on in the fall, and anyone that wants to volunteer to be on that? No. All right, well, I'll put out an email and hopefully people will, if not, we'll just have to handle legislation in each of the subcommittees that already exist. That might be the best way to do it anyway. Great. And then that disease repository was something we had talked about in the former report. And perhaps that should be tabled until the EBC discussion happens next month, but that's something in the back of our minds is, you know, how do we, once we have the structure of the table, how do we facilitate looking at geospatial analysis and things like, Amy, you were talking about with the residency time and things like that, and how do we actually start looking proactively for issues? So that's kind of like what we had been talking about in the past about the repository. So I think I'd like to continue that discussion in the data subcommittee after next meeting when we have the EBC update. Any comments on anything else that maybe I'd forgotten to cover in this meeting?
And I would like to volunteer whoever is appointed by the Medical Society to participate in the data subcommittee.
Yes.
Please.
Good idea.
Just to get all clinical hands on deck.
Yes. Peg, are you part of the education subcommittee?
I am.
Okay. Do you have a list? Actually, I don't have an updated list on who is on that committee, the subcommittee.
I as well.
You are, Gary?
Yeah.
Got it. Okay. Right, we'll try and reach out to those people. Anything else that anyone wants to bring up?
I had a question for Karen, just a trick to tickle my mind about data and data handling. Issue came up in Health and Human Services on a regular basis about opt-in, opt-out with, you know, identifiers and all this kind of stuff, and how registries are collected, all that. And then Representative Jess Edwards came up with a modification to one of our bills to have an oversight committee as to an internal committee, and I think it resided in HHS, and had to do with how all data is shared by department and divisions to make sure that it's done properly, et cetera, et cetera. And I'm just wondering if Karen knew, if any or anybody else for that matter, how that might trickle down in terms of our ability to collect some of this data that we need, because it became an issue in our committee this year. And I just want to, how, if there's been any concern, shall I say, going forward with data collection.
So I think there's variance by data set, and I think that this would be a question best answered by the Division of Public Health Services Bureau of Health Informatics and Statistics.
Yeah, I'm just not sure where the Jess Edwards, I've forgotten now. It came through our committee, but it's been quite a while, and exactly where it's going to reside, but it did pass the House. So it will affect, and it's going to be an oversight committee, and it's going to determine exactly how registries are handled and what information can and cannot be shared.
Okay. I don't want to put Jawei on the spot because I know she's here providing logistical support, but I'm happy to, you know, I plan on bringing updates back to DHHS and DES, and so I'm happy to connect with the Bureau of Health Informatics and Statistics to talk about that.
Yeah, I just thought something we should have on our radar. My apologies for not being more facile with the details. But I'll tickle it myself and see where it is.
Okay, I'll do some digging too and see what I can find, but thank you for that.
Yeah, if you could report in onto in June on that, the next meeting on that, that would be great, because that actually is really important to.
So, are you if you're talking to me, I think that would have to be a DHHS report in. So it's certainly something I can ask them about, but that's not that would definitely be DHHS.
Are there any issues with data sharing in terms of like environmental samples though?
Do you mean data sharing across agencies? I mean, so we do have an MOU with agencies. You know, I think there's differences by data set because certain data sets have, you know, protected health information versus, you know, sampling data that might not. So I think it depends on the data set. We do work together to try to integrate data where possible, but depending on the specific data set, we can't necessarily just pass it across the, you know, agency lines.
So I guess what I'm asking then is, say we wanted to recommend this repository for the Merrimack area, say, and we wanted to have crosstalk between the two agencies on the water results and health outcomes. Would there be any roadblocks on DES's side in sharing that information with the HHS in terms of the disease outcomes? And I mean, in terms of the contamination detected, utilized to look at geospatial analysis, small area analysis in Merrimack.
So that's a question that I can follow up on. I mean, I know DES does make data publicly available related to water quality results. I don't know that you can pinpoint it to the address level because that, you know, that's
you can
someone's home. So in terms of sharing it across agencies, I think a lot of that data was integrated into that well water dashboard. It's not specific to Merrimack, but it's statewide, and you can drill down to the community level.
Did you put a link in the chat for that well water dashboard too?
I did not. That's something that I would follow up with Katie about the well water dashboard.
Okay. Okay, great. All right, I think that any other comments from anyone or questions about anything we've covered so far? Okay.
I did put a note in the chat just if we want to take one thing off of the follow-up list. Dr. Patali can speak to the question that you asked earlier about the letters and communication that go out relative to national priority list sites.
You said you put it in the chat?
Yeah, I just said if we want to circle back. So John, if you're available to speak to that question, can you weigh in now?
Yeah, I'm here. So yeah, there is an issue where some of the national priority list sites are still following the 70 parts per trillion combined for PFOA, PFOS. That's because the standards that they use for cleanup and notification at these sites are usually defined in an agreement time for the site. And during their 5-year reviews is usually when these can be updated. So for a lot of these, if they haven't had their 5-year review since 2019 when the new AGQS went in, that's one of the reasons that some of them may be sticking to that. I know around the Pease former Air Force Base, there are some issues of they're still only recognizing the 70 number that came out from EPA, and we're still having some issues with having them acknowledge the AGQS that we have in New Hampshire. As a part of the Apple Tree program, we do reach out to residents and we do work with the state side of the site investigation to identify where there are exceedances and try to contact those individuals, let them know that they're above our state standards. Some of those actually include examples from in the Londonderry area where there has been a lot of testing going on relative to the St. Cobain emissions. We've been doing a lot of PFAS testing down there, but some of those are related to actual MPL sites that are down in that area, not from the other broader impacts. And we have done outreach to those groups. So in those cases, that's usually something that our Apple Tree program tries to work with the MPL site to at least get the data and reach out to residents.
Yeah, so if you wouldn't mind bringing it back, then the one I have encountered it on is the Coakley landfill site. In particular, I know about the Pease one, and I think the Air Force has just in the last month said that they were going to start addressing paying attention to the state standards at Pease. So that's good. But I know for a fact, I was talking about some of the Rye area wells. Actually, it was not just NPL sites, it was with respect to landfills too. So I'm not sure if that would be handled under Apple Tree or not, but that's an entire state issue, entirely a state issue.
So if it's not an MPL site, but it's a state investigation site, that would be something that our site investigators would be overseeing. And we have been working with a lot of them to identify areas that need that kind of outreach. It's something that if you know of specific places, if you want to contact us, you can either contact me or Karen or Rob. I think you have most of our emails. We can follow up on that and see what's going on with those specific situations.
Okay. So Apple Tree will cover the NPL sites, the federal sites, and the state handles, yeah.
So Apple Tree can assist with all of those. It's the thing that it's primarily funded for national priority list sites, but ATSDR recognizes that not everything that's a concern is an NPL site. So we have leeway with our staff that are funded through this program to assist with those other sites. So it's not cut and dry, but we try to basically triage it and get it to the right staff in here. But because of this grant, because of Apple Tree, we have that expanded capacity now to address these concerns.
Great. Did I hear somebody else interject also?
No, it was just me, but Jonathan provided the information that I would have provided. You know, anyone can petition Apple Tree for support relative to a specific concern. Like he said, there is leeway for us to establish state identified sites.
Oh, I wasn't aware of that. So any community can petition Apple Tree. Huh. Okay.
Yeah, yeah, and that's the thing. We have principal investigator. I support it as both toxicologist for the state, but also support to that time. We have a risk assessor, so it's something that we help out at any of those sites. It's just a matter of reaching out to us.
Yeah, and petition sounds formal, but it's really just reaching out and having a conversation to share the concern, and then our team would work on the scoping of what the response would look like with community input.
Great. All right, any more comments on any of that? If not, we'll talk about our next meeting. So I had put down, I had been asking, I wasn't sure if Fridays or Mondays were better. I know when we have legislators involved, generally those are the 2 days of the week that are best to work around committee meetings. So I did hear from Senator Riccardi that Friday afternoons were bad for her. So Friday mornings would be the time we would have to stick to, and we have some other commissions running. So that some of us are involved with that also on Friday morning. So was wondering if Mondays would be okay for most of the people here or not. I haven't heard that it wasn't okay for some of the other people. So was wondering if that was okay for people who are here now, or better or worse, or just some feedback on that.
Mondays work for me as long as we wrap up by 2.
Any other concerns about Mondays?
Well, Mondays are pretty good for me anyway.
Oh, good. Okay. And Mr. Timmons, do Mondays work for you?
Mondays are better for me, actually.
Oh, good. Okay. So I was going to suggest either the 6th or the 13th for our next meeting on Monday, 10 o'clock in the morning, if that works for people.
I cannot make the 13th. I have an Air Resources Council meeting. But the
6th for me.
6th.
Say that again. Who was that?
6th is better for me.
Okay. So why don't we do the
That works
6th at 10? I know Representative Murphy will not be on the trip to the warmer climates that day. Is that right? I can't remember what you said.
No, I'm around till the PFAS conference on the 15th. 14th,
Okay, so it's not the 6th. Okay, so why don't we do the 6th at 10 a.m. if that works? And so I'll put together an agenda based on the stuff we were talking about today for the next meeting. And if the data subcommittee should also meet, and perhaps since we're all here, I could suggest a time for us to do that now, if you don't mind. Does Monday the 23rd work for the data subcommittee people? Also at 10? No. Amy, what day
No.
works for you? Friday the 20th, or let's see, we're talking about June 6th.
And we're looking at Mondays or Fridays?
Yes, probably just because we'd like to have people like Representative Woods there, and I know. So maybe the 16th? That's kind of soon though. That's Monday, so we can't do that. Never mind. The 30th is Memorial Day. All right, so let's go to a Friday then. How about June 3rd? At 10 o'clock. Is that, I can't remember what our other meeting is set at.
We could do June 3rd at 10 for.
Okay, June 3rd at 10 for the data subcommittee.
If that's an hour or.
Yep.
I may have to back out a little bit early for that, but I'll have to leave a little bit early at the end of it. That's the best slot.
Great. Nancy and Representative Woods, is that okay with you?
Yeah, I have a conflict, but it'll work out all right. I don't have to be at the other one.
Okay, perfect. All right.
That gives you time to get someone from the medical society.
Yeah.
Question about the meeting for the 6th of June. So will we be having the option of doing virtual, or will we still will? Okay, thank you.
Yes, absolutely. Sounds great. All right, so I'll get the agenda and the notices out for the next meetings, and I appreciate your participation. And we're not going to do a formal roll call for Amy. Did you have something to say?
No, that was a goodbye.
Oh,
Sorry.
okay.
And then I
All
remembered,
right.
yeah, we probably have roll call or adjourn.
Yeah, no, we don't have a quorum, so it doesn't really matter. All right, thank you so much, everyone.
Bye, everybody.
Bye.
Bye-bye.
Bye.
Have a good weekend.
You
You
too.
too.
Bye, Gary.